Good afternoon. It's 2 o'clock. Thanks for joining us. It's time to begin today's briefing. Our featured speakers today are Milwaukee Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of the Milwaukee County Medical Services Office of Emergency Management, Darren Rausch, Health Officer and Director of the Greenfield Health Department, and Gregory Brusco, Chief Clinical Officer at Ascension, Wisconsin. Mayor Barrett, you're starting us off today.
Well, thank you very much, Sydney, and good afternoon, everyone. Happy Thursday. I think the best place for us to start is just an update. I think we all recognize that the demand for testing has risen quite dramatically as we see the numbers rise, not just throughout the state of Wisconsin, but here in southeastern Wisconsin as well. And we're pleased that people are taking advantage of the sites we have. I realize that the lines have gotten longer. I've seen the news reports of the lines being longer at Miller Park. Fortunately, we have now opened up the south side, a second location on the south side that we call Zone E on the former Bucyrus grounds. But just to give you a snapshot of what the numbers are, at Miller Park yesterday, we had just fewer than 2,000 tests, 1,985. Northwest Health Center, we had 550. The Southside Health Center, we had 456. And then at the new site at the South Shore, we had 432. So you can see we're doing well above 3,000 tests serving Milwaukee County right now. And that's important. Our total for the week is getting close, and probably by now it's surpassed 10,000. As of yesterday, at close of business, it was 9,670. We recognize, and it's great that the county executive is on this call as well. We recognize, the county recognizes, the state recognizes that this pandemic is wreaking havoc on people's economic situations as well. And so as we try to deal with all of the issues that are out there, the emotional issues, the mental issues, the health issues, the financial issues, we're pleased that we're able to put in place a program for financial navigators to help individuals in our community literally navigate their way financially through the troubling times we have. So yesterday, the city of Milwaukee launched its Financial Navigators program, which is designed to help residents deal with the financial impact of the COVID-19 pandemic through remote assistance navigating critical issues and referrals to social services and resources. This is a network of cities around the nation that are involved in this. And we were selected by the city's financial empowerment to receive $80,000 in grant funding, technical assistance, and training to launch the program. We've got some strong national partners. In fact, Bloomberg Philanthropies, the City Foundation, Wells Fargo, and JP Morgan Chase have also supported this effort. We've got a great local partner because we're working with Riverworks Development Corporation to provide this service to our residents. And again, it's designed to help residents navigate the financial impact of COVID-19. And that's a critical part of our city's frontline emergency response efforts. We've talked about the Restart program, the money we're able to give to businesses. We've talked about the eviction program, trying to help people stay in their homes. This is another tool that we're using to help individuals who are really hit by this pandemic. Residents can request a financial navigation appointment directly or through other community organization referrals. You can call 414-882-74 or complete the online form at milwaukee.gov/FN. Just to give you a context, the session will typically last about 30 minutes and may include discussions on how to manage expenses, maximize income, and how to create a plan moving forward. So I strongly encourage our residents who need financial assistance to take advantage of this program. I want to turn now to the election. We all know that the clock is ticking. We are very pleased with the number of people who have voted. Yesterday, we had our largest day of early voting at our 14 sites. So as I predicted, we saw an early burst on the first day of early voting, and then it dropped a little throughout the week. But now that we're within 5 days of the election, I think we're going to see those numbers climb every day. We're very pleased that we are basically well over half the number of people who voted in the 2016 election. So people are certainly voting early, and we encourage people, whether they decide to vote early, whether they decide to mail in their absentee ballot or drop off their absentee ballot, which is probably much preferable right now, or whether they decide to vote on November 3rd, just to have a plan. I want to remind people that while we still want to encourage people to take part in early voting up until Sunday, November 1st, we also want to be sure that you are successful in casting a ballot if you are planning to vote in person on Election Day, November 3rd. The polls will be open from 7 a.m. to 8 p.m. We have 173 sites that will be open. This is a far cry from the 5 sites we had in April when we were losing literally dozens of election workers by the hour because we had the stay-at-home order in place. We have created what I describe as a marriage between our election commission and our health department. We've spent considerable amount of money on PPE and other devices to make sure that this will be very safe. So if you want to vote in person, you certainly can do so. And again, the polls will be open from 7 a.m. to 8 p.m. on Tuesday. Our drop boxes are also available to you to return your absentee ballots also. These have to be in though, and I would say play it safe, because the absentee ballots that are dropped in the drop boxes have to be at our central count by 8 p.m. on Tuesday. What does that mean for you? That means that you better get there no later. I think our last pickup is going to be around 7:30, but I wouldn't even take a chance. Get there before 7 o'clock on Tuesday at these drop boxes, at one of the 15 drop boxes we have throughout the city if you want to take advantage of that, because it does not count being in our possession unless it is at central count by 8 p.m. That means we have to give time for our runners to get it from the drop boxes to central count. So again, make sure that you're making a plan for that. All ballots must be in by 8 p.m. on Election Day on November 3rd. If you aren't sure where your polling place is, you can search using your address on milwaukee.gov/414votes, and it will tell you where to go on Tuesday. Of course, make sure that you bring an acceptable form of ID, a photo ID. It does not have to have your current address. It has to have your current face. It doesn't have to have your current address. And make sure that you have a face mask with you for your own protection and the protection of others. While you are in line and in the polling placing location, remember to maintain a 6-foot distance from others around you, keeping your mask on, avoiding touching your face, and use hand sanitizer when you're done. So with all of this going on right now, what better time to start the open enrollment period for the Affordable Care Act, just to make things more complicated. The open enrollment period for the Affordable Care Act kicks off this Sunday on November 1st. The good news is that there are more health insurance plans to choose from for coverage in 2021, and 8 out of 10 people who sign up receive financial assistance in terms of subsidies or tax credits to lower their monthly premium. Here's the other good news. More than 67,000 people in Milwaukee were uninsured before the pandemic, and a number of those were able to be helped because of the Affordable Care Act. Unfortunately, we know that the number has grown as folks have been furloughed or had their hours cut. So that's why it's so important for everyone that knows that they are very likely to be able to find affordable health care coverage for themselves and their family. I recognize that health insurance can be confusing, but free help is also available to anyone who would like to learn more about their options, whether it's the healthcare marketplace, whether it's Badger Care, whether it's Cobra. So please just call 211, not 911, call 211 or visit healthcare.gov to check out our brand new user-friendly website, whizcovered.com. But remember this, open enrollment is just 6 weeks from November 1st through December 15th. So people need to start planning now to learn more about their options and to sign up by that December 15th deadline. Finally, this weekend is Halloween. By this time, we're usually preparing to see little trick-or-treaters out and about ringing their neighbors' doors for candy. As we announced earlier this year, trick-or-treating is considered a high-risk activity for spreading COVID-19. That's why we encourage residents to have a reimagined Halloween by engaging in creative alternatives that are low risk. We still, notwithstanding whatever the dentist or the dietitians say, it's still okay from my perspective for the kids to eat candy. But again, do so in a way that's low risk. The Milwaukee Health Department has created an online Halloween guide of alternative activities that can be found at milwaukee.gov/coronavirus. I know that many of you would prefer to spend Halloween the way we always have, but unfortunately, as you'll hear from Dr. Weston and others, because our state is recording record numbers of cases, we are putting the health and safety of our residents first. So with that, I'm going to turn it over to the county executive to talk about some other important issues. Mr. County Executive.
Thank you, Mayor Barrett, and thank you for that information as well. So today I really want to start off by acknowledging the tragic trend that we are seeing in major cities across the nation, but also including Milwaukee County. We have already broken the previous record for the number of homicides in a year. So according to our Milwaukee County medical examiner, this year we've had 174 deaths. There's no question that the stressors of this pandemic have tested county residents, whether we're talking economically, physically, or mentally. But the pandemic has also worsened many of the insecurities residents have already faced. And with this in mind, Milwaukee County is on a mission to invest in improving health outcomes and becoming the healthiest county in Wisconsin. And we know that healthy communities are also safe communities. But this year has been unexpected in many different ways and in every way. But in response, we've allocated $77 million in CARES funding to alleviate much of the pandemic-related stress as possible, whether we're talking about preventing evictions, aiding small business owners, getting residents back to work, but also increasing access to mental health services. These aren't the kind of records that we want to set here in Milwaukee County. But I will say that I am optimistic, and some would say, recklessly optimistic, that we'll be able to see a reversal in these alarming trends as we continue to make progress on controlling this virus and return to familiar routines, whether we're at work or at home. But until then, we'll have to continue to do all we can to keep people safe and provide the resources we need to help folks navigate this challenging time. But continuing our work to keep our community safe and healthy, we want to do what we can to reduce the risk of Milwaukee County employees contracting COVID-19. But in order to accomplish this goal, we will be sending out a new health screening administrative order next week. This order will require all Milwaukee County employees and contractors to complete a daily health screening for COVID-19 symptoms and exposure on days that they work in person. And once this order is activated next week, the procedures will be rolled out in phases. The first phase will feature the daily screening. We recognize this may cause a minor inconvenience for some county employees and our contractors, but the benefits of daily screening far outweighs any inconvenience. And for those who are impacted by this order, we want to thank you in advance for your willingness to help ensure that we have a healthy workforce. Complete information on the procedures and the phasing will be included in next week's administrative order. Again, our highest priority is really keeping county employees and the people we serve safe from this disease. And finally, as the mayor touched on, Halloween is just days away, and we want to remind everyone to have a safe, reimagined Halloween. And so according to the Center for Disease Control, the CDC, many traditional Halloween activities that include trick-or-treating are considered to be high risk for spreading COVID-19. And there are several safe and alternative ways to really take part in this year's Halloween celebration. I mean, for me and my family and my girls, they have their costumes ready, and we're ready to carve some pumpkins this weekend. And on Halloween, we'll do a candy scavenger hunt and watch, Halloween movies. But no matter how you decide to celebrate, please make sure to follow these guidelines, which is if you have any COVID symptoms, please stay home. Don't wear two masks. A costume mask is not a substitute for a cloth mask. A costume mask should not be used unless it is made of 2 or more layers or breathable fabric that covers the mouth and nose and doesn't leave gaps around the face. You want to maintain physical distancing, keep activities outside as much as possible. And with that in mind, I want to hand it over to Dr. Weston, but also to say thank you not only to him, but many of our public health officials for all that they've been doing in their commitment to keeping us safe.
Thank you, Mr. County Executive. Good afternoon. First to our numbers, we've had 41,130 confirmed cases of COVID-19 in our community and 484 individuals who've died. We continue to see, frankly, terrible trends in the state and also in Milwaukee County. In the county, our percent positive for testing is climbing, along with increased testing numbers. This is a bad combination that indicates very high disease activity in our community. Meanwhile, our hospitalizations in the county took another jump, now up to 325 individuals hospitalized with COVID-19, nearly 100 more than we saw at our previous peak back in April. And at a county level, as well as a state level, these trends are not slowing. The curve is not flattening. We're not rounding any corner. We're seeing a steady and steep upward trend in cases, in hospitalizations, and tragically in deaths. There are harder days ahead, to be sure, and every individual decision, every gathering avoided certainly makes a difference. That brings us to Halloween. As the mayor outlined, as the county executive outlined, this will not and frankly cannot be the Halloween that we're all used to. Traditional trick-or-treating, unfortunately, is not a safe activity this year. It'll be different, but there are safe alternatives. So whether, like the county executive mentioned, maybe it's pre-setting out candy bags and doing social distancing in a small distanced group, a virtual scary movie night, a costume contest, a scavenger hunt with members of your household. But we have to remember the basic layers of protection with COVID: masking, and as the county executive outlined, a regular cloth face mask, the rubber, monster mask that doesn't work as a mask, distancing, and being outdoors as possible. And wearing my emergency room doctor hat, I'd be remiss not to put out a reminder about wearing reflective clothing, carrying a light if you're out at night, particularly if you're out with children. And we know that Halloween is not just for children. So for the adults out there, unfortunately, this is not the year for in-person Halloween parties. It's not the year for traditional haunted houses. We need to remember that Wisconsin's in a very tough spot right now with skyrocketing cases and hospitalizations, and we must be responsible and modify our individual behaviors. Certainly orders and capacity limits are important, but it's the individual actions that will make a difference in the coming days and lay out our path for the coming months. Any way you look at it, the fall and winter months to come are going to be challenging. They're going to be challenging from a disease perspective as well as a mental health perspective. But by making safe and responsible personal decisions, we can give ourselves and our community the best chance to stay healthy. Thank you and stay safe, and I'll hand it off to Director Rausch of Greenfield.
Thank you, Dr. Weston, and good afternoon, everyone. My name is Darren Rausch with the Greenfield Health Department. It's my privilege to join you today to talk about some of the data that we're seeing on top of what Dr. Weston has already shared. First of all, I want to start out by just kind of hitting some of the highlights that you'll see in the data as I walk through it in a few minutes. Continuing a trend that we saw last week, Milwaukee County continues to have some of the worst disease that we've had at any point during the pandemic. No matter how you slice the data, we have surpassed every previous peak that we've seen over the past 7 months within the last couple weeks. The city of Milwaukee is experiencing their highest totals. The city of Milwaukee is averaging about 325 daily cases when we look at a 7-day average. The suburban communities are also averaging the highest numbers we've had at almost approximately 200 cases per day. The disease in children is trending similarly to the disease in adults, and those numbers are also at their highest at all times. Secondly, I want to point out that we're still continuing to monitor some very disturbing trends in the social determinants of health. Specifically, we continue to watch high hospitalization rates amongst those who are in our oldest population group, those 80 and above. This is a trend that has steepened within the recent weeks, and we need to continue to watch that carefully. We are continuing to monitor trends of deaths in our community. We know these are lagging indicators, but we've seen deaths spike in many other parts of the state and country recently, and we need to stay on top of that as well. Also, we continue to monitor high rates of disease in our Hispanic Latinx population. That is 2.2 times higher than that of any other racial and ethnic minority in our community. So these are still very concerning to us in the community. And lastly, I'll leave you with this thought before we jump into the data. To all of the Milwaukee County residents that are listening, others within southeastern Wisconsin, the solution starts with you. The solution starts by wearing masks, watching your distance, and washing your hands, avoiding large and small gatherings for that matter to limit the disease spread. As I've mentioned several weeks back, especially as we were talking about school reopening, It's the collective decisions that we're all making that have a direct impact on the burden of COVID in our community, in our county, and across the state of Wisconsin. So let me go ahead now and shift gears and talk about the data quickly. This graph in front of you right now talks about the daily trends and the 7-day averages for both the Milwaukee County suburbs and the city of Milwaukee. And you see that we are definitely trending up and in a direction that we don't want to be. This graph shows the entire population, and we certainly see the high rates that we are on with no end in sight or end of leveling off. Similarly, we can look at the same trend in our children population. This is a graph now looking at those under the age of 18 and under, excuse me. And we see a similar trend. While we had a little bit of leveling off in this particular age group early in September, we are seeing increasing trends as the page turned into October. So back to our county report. We watched deaths carefully, and again, this is a story that we've seen. We seem to be pretty stable, but we certainly are watching this data closely because this data does tend to be a lagging indicator. And we know that death rates have skyrocketed in other parts of the state. I want to talk about our reproductive number or our transmission rate. We've talked about this a lot in the past. Generally, since the first part of September, our transmission rates have been above 1. That means that for every individual who gets COVID, they are infecting one or more individuals with COVID themselves. And we see some really high rates here in early September around the Labor Day holiday. And we continue to see some additional spikes as we get into October as well. We can look at this data too by city of Milwaukee and the suburban communities. And we can actually see that over the last month, the transmission rate in the suburban communities has been much higher than that in the city of Milwaukee. And that's something we certainly want to pay attention to. We want to have that transmission rate be below 1. We're tracking all of the demographic patterns as we have in the past. Rates continue to go up across all population groups, specifically though in those younger adults, the 25 to 39-year-olds, as well as the 40 to 59-year-olds. In addition, we talked earlier about hospitalizations. We continue to very carefully monitor the hospitalizations in the 80-year-old population. You see right here, they have the third most hospitalizations overall in our population, but their rate has really trended upwards. And when we look at that particular graph as a rate per population, their rate of hospitalization of those who are 80 plus is over 2 times higher than the next population subgroup and 14 times higher than our college age population. So we really seriously are monitoring that situation that could be very problematic as we go forward. I want to talk next about testing. Testing coverage has been increasing largely over the past several weeks. Again, we report data pending for the most recent week, but we've seen a steady increase in completion of testing. And we know that testing is needed, and we know that testing is necessary. And quite frankly, we know that throughout the Milwaukee area and even in southeastern Wisconsin, we have seen and heard of testing sites that have run out of testing on the days that they are operational. So again, we encourage everybody who needs a test to get a test, whether you're symptomatic, whether you've been exposed, or you have concerns about your disease status. We certainly understand that there may be some limitations at time, but urge you to really try to get that testing when you need it. Unfortunately, the testing data also reflects a very disturbing 14-day trend. We have a statistically significant increase over the last 14 days. Not surprising given the data that I talked to you about earlier with increasing disease rates. Next, let's look at the spatial patterns. We've talked before how the disease has really gone rampant across the county over the last 7 months as we look at this particular spatial map here of our geography. But more importantly, if we look within the last week, we see disease really across the county. We see disease throughout the suburbs, throughout all parts of the city of Milwaukee. There really isn't any part of the county that is not currently experiencing disease. And similarly, when we look at those who have been getting testing in the last week, we see a pretty good look at a pretty good balance of testing throughout the county, although there certainly are some areas that here in the blue that maybe aren't accessing testing to the extent that they could or should. So in conclusion, I just want to continue to point out to everyone, the data continues to show that COVID is surging. We have no idea when this current peak will be turning the other direction. So we need to remain vigilant. Cases are up significantly over the past several weeks. Cases are up significantly within the last week. And this has also caused significant delays in the public health follow-up. In doing the important public health work of disease investigation and contact tracing, we are now having to prioritize disease investigations because the burden is so significant. This is not unlike other health departments across the state and across the country. When we have to prioritize because the disease burden is so high, this has a significant impact on disease containment and control. Additionally, we know that hospitalizations have been surging in many parts of the state and also appear to be increasing here in the Milwaukee area too. And certainly to speak more about hospital capacity in light of the COVID-19 pandemic, I'll now turn over the briefing to Dr. Brusco from Ascension, Wisconsin. Thank you for your time and attention.
Thank you, Darren. And good afternoon, everybody. Healthcare providers in Southeast Wisconsin are very concerned about the increase in COVID-19 cases. We all see the numbers rising, and Dr. Weston and Mr. Roush just presented the objective information of the current state of COVID-19 in our communities. My comments, however, are going to be a little bit less about the numbers and a lot more about you, your family, your friends, your neighbors. As healthcare providers, we have a unified message for our communities. First and foremost, COVID-19 is real. We're urging the communities to take action to protect yourself and your community. We understand very well that the public is tired. Frankly, so are we, and so are all our associates. We also recognize that there is sometimes conflicting information in the public about what preventive measures actually work. Folks are unsure of who and what information to trust. Our message is clear. You trust us to take care of you when you're sick, right? We're asking that you trust us when we say the following. Individually, every one of you has the power, every single one of you, the power to keep yourself safe, the power to keep the people around you safe, and frankly, it's pretty simple and really doesn't cost too much. Wear a mask, wash your hands, watch your distance, and get your flu shot. If we all take these small actions that I just outlined, we can turn this around and keep ourselves and our loved ones safe. As healthcare providers, we stand united in our community to care for the health, well-being, and safety of the communities that we serve. We will be here for you when you need us. We're asking, will you join us? Thank you.
Thank you, Dr. Brusco. Our first question comes from Aaron Maben at Fox 6 for either the mayor or Dr. Weston. The new public health order begins today. Can you remind businesses and the public why this order was put into place, and when will we know if it's working to slow the trend?
Well, Doctor, you want to talk about the health aspects of it, and I can talk about it a little bit from the business aspects?
Sure, absolutely. So to the question of why the order is put in place, I think the numbers that we see speak for themselves. The rising cases, the rising hospitalizations. We're in a different place in this pandemic than we were in April or than we were in July when we saw the second surge. This surge far outpaces any of those others. And so much as we're seeing at the state level, much as we're seeing around the country, and frankly around the world, it's time to tighten up. It's time to tighten up with social gatherings, with close interactions with others, and make those key individual decisions to keep us and our community safe.
And I want to add, as Commissioner Jackson said yesterday, this is not meant to be punitive. This is because we are very concerned, as Dr. Weston has indicated. These numbers are bad. And when I say numbers, I probably shouldn't use that word because it's not about numbers. It's about people. This is a very serious situation in our community, in our state, in our country. And as Dr. Weston said, we're seeing in Europe that it's getting ugly again. So we have to take this seriously. And for those who have denied it, that's a huge mistake. And that's where I think Dr. Brusco was very, very much on point what he's saying. This is real and this is serious.
Thank you, Mayor Barrett. Our next question comes from Sari Lusk at the Milwaukee Business Journal. For Mayor Barrett, as the tighter restrictions take effect today that lower capacity in restaurants, bars, and entertainment venues, how many cases has the city tracked back to restaurants and bars?
I don't have that information in front of me. We can get, obviously, the health department to help us get that information to you. We know that any place you're going to have congregations of people in confined areas, those are the breeding grounds. And so that includes places like funerals and weddings, places that we intuitively think would be the safest places turn out sometimes to be the most dangerous places.
The next question, also from Sari Lusk for Dr. Weston or Commissioner Rausch. With hospitalizations increasing, how is the Milwaukee region doing with capacity? Are there concerns about hospitals hitting capacity?
So I can start on that. I think that Milwaukee County had the advantage, perhaps, I don't know if that's the right word for it, but either way, of seeing the initial surge back in April and doing putting the plans in place back in April. And so all the health systems, and this includes Dr. Brusco, who was very involved in this process, all the health systems put together surge plannings. How would we ensure that we could care for every patient in need? And that included looking at non-clinical spaces in the hospital, included putting together and advising on the alternate care facility that is now seeing patients. So I think Milwaukee County hospitals are in as good a position as they can be, considering what's going on around us. Now, that said, we're seeing a spike that is just continuing to go upward. There's no, like I said, there's no flattening of the curve going on right now. So no matter the capacity we have, the trajectory we're seeing is certainly concerning.
And I'd like to add to this because I've seen the headline in the paper this morning about a shortage of ICU beds, and Dr. Brusco can talk about it from Ascension's perspective, but I want to echo what Dr. Weston said. We started meeting as a group back in March, and one of the things that impressed me the most back in March and April was how cooperative and how coordinated the effort was among our healthcare providers to put out a blueprint for what it could manage and what it could project to manage with the number of beds, the number of ICU beds. All of that was laid out in the springtime. And just as the alternative care facility was established in the springtime. So that has given me a little bit assurance that, all right, we know where we are now. We know what our challenges are. But if this keeps running at the rate it's running, that's a different story. But I think at this point, Milwaukee County is in a relatively good position when it comes to the beds.
Our next question comes from Mary Spacuzza at the Milwaukee Journal Sentinel. We understand the city of Milwaukee contact tracers are currently facing a backlog of nearly 1,600 positive cases. Can you speak to how overwhelmed officials are and the danger of people socializing as tracers may be trying to reach them?
I can talk about that because we talked about that on our call this morning. We know around the state of Wisconsin that some of the tracing efforts are completely overwhelmed. We do have a challenge right now in the city that the length of time to reach individuals has grown by about a day and a half, I believe is what the commissioner told me this morning. And so as we talked about it this morning, our conversation centered around the need to see what we can do to ramp up those tracing efforts. Am I concerned? Yes, I'm concerned. Am I panicking? No, I'm not panicking.
Thank you, Mayor Barrett. Our next question comes from CBS 58 News. Dr. Weston or Commissioner Rausch, are you asking people to do their own contact tracing if they test positive?
Yeah, to expand upon what Mayor Barrett mentioned in the city of Milwaukee, all health departments throughout the southeastern region and really across many parts of the state. If you go to the state of Wisconsin website, the burden of disease for COVID-19 rates across the state are all in the very high category, except for 2 counties statewide. The 2 counties that aren't very high are also just in the high category. So there's a lot of disease throughout the state. In the southeastern part of the state, we are all met with the need to prioritize both disease investigations and contact tracing. And in a situation where we walk into the office and we have dozens and dozens of cases, in Greenfield, for example, we walked into the office on Monday with 94 cases waiting for us. And that was even after working Saturday here in the office. With that number of cases, both Greenfield and other health departments throughout the southeastern region and throughout Milwaukee County have had to prioritize disease investigations. And we're starting to prioritize those disease investigations by looking at those who are in high-risk living settings. We're discerning that by age. We're looking at those who are over 65 who are going to have the most complications. They get first priority. We're looking at the school-age population who may be in school settings or other high-risk settings as a second priority. And then we're looking at workplace and school outbreaks in colleges and universities and work sites as the third priority. It is our sincere hope that we're getting to all of the disease investigations, but the numbers of cases right now are overwhelming. And then to get back to the question at hand, yes, if we're prioritizing disease investigations, contact tracing is also getting prioritized. And we are, because of the volumes we're facing, we are asking positive cases to help us notify those people that they have been in contact with and encouraging quarantine and all of the measures that we need to do, because we're not quite sure how quickly we can get to them. And with case rates as high as they are, it's not going to be as fast as it was a month ago, much as Mayor Barrett described for the city of Milwaukee.
Our next question is from Mary Spacuzza at the Journal Sentinel. This is for Dr. Brusco. Dr. Brusco, are you seeing patients coming in sicker than earlier in the pandemic, as other providers have said?
Yeah, so interesting, we saw sort of a transition. When we first started to feel the current surge, I guess I'll say, we had a tendency to see a little bit more med surge type of patients, and the ICU patient population was not quite as intense, I guess I'll say, as it was back in the spring. Lately, however, because of the incredible surge that we've all have seen the data about, that trend is starting to slide a little bit more, where we're starting to see our ICUs have a higher proportion of more critically ill patients. One could suggest that obviously as the overall positive rates go up, particularly exponentially as they are, inevitably from a percentage standpoint, we're going to see a certain amount of ICU and med surge. So while that trend was a little bit more med surge earlier, I think because of the rapid surge and the profound increases that we're seeing a little bit higher sicker population over the more recent times.
Thank you, Dr. Brusco. That appears to be all the questions in chat. I'll give a last call for media questions right now. All right, thanks everyone for joining us today. I do want to note there will be no media briefing next Tuesday due to Election Day. Briefings will resume next Thursday, November 5th. Actually, we had one more question come in real quick from Mary Spacuzza at the Journal Sentinel. We've heard of testing sites closing early because they are at capacity or have run out of supplies in Milwaukee and elsewhere. Do we have any other updates on efforts to expand testing in the city and county?
I can tell you from a city perspective, we obviously have expanded the capacity pretty significantly. And I think the addition of the South Shore is a very, very welcome addition. That's what we're looking at right now. We're going to continue to try to get as many tests as we can. And what we want to do next is try to expand to weekend hours at the Miller Park site.
Thank you, Mayor Barrett. Again, I believe that's all the questions we have today. There will be no briefing Tuesday, November 3rd on Election Day. We'll be back on Thursday, November 5th. Thanks, everyone.
Thank you very much.